Dr. Schultz at the Centennial Schultz Clinic, mid-March 2021. Thank you for checking in today. What we're going to be talking about specifically is the truth of stem cell therapy for low back pain. That's right, you know, the stuff that always reminds you, it's always there. It may just start off as a little kind of crank, but by the end of the day, it can be a knife-like searing pain which can stop you in your tracks. So this is a complex topic, and I don't expect to make you all experts. But what I'd like to review today are the different types of stem cells. That's right, there are more than one. What are the different structures in the low back that can be causing you pain? And most importantly, how you can get the very best results from treatment for your low back pain. And why are we doing this? It's quite simple. I'm doing this so as to prevent you from going in and meeting a clinic like this, where your future is bright and all can be healed with stem cells. We've seen patient time and time again come into a clinic that has had that pitch that, you know, with these little cells, we can treat you. That's not true. Your pain is real, and I want to honor that and help you understand some of the very important issues. So let's get started. Not all stem cells are the same. Just like apples, there's more than one apple. There's Granny Smiths, there's Gala. So too with stem cells. So that's the first question. The most common is bone marrow derived. What that means is it comes from the bone marrow, and we use it we obtain it off the iliac crest. That's the most common, and that in terms of the literature is the most this is the most common that's been researched in detail. The second is what's called fat or adipose. It can also be effective as a graft, but the cells are bound. And then there's this thing called birth tissue. Now, birth tissue can come in a couple different names, one of which is called Wharton's jelly, umbilical fluid. There have been many reports and many studies that examine that, in fact, there are no living cells in birth tissue. So don't fall for that scam. University of California at Sacramento, Cornell University, and at CSU have all demonstrated that there are no living stem cells in birth tissue products. Number two, what are the different sources of back pain? Back pain can come from a lot of different sources, and the major ones are this: a facet joint, a disc, the ligaments, the muscles, and then the tendons. They're not isolated, they in fact play a role all together. So the facet is this small little joint between here and here, and here and here. It's a paired joint. There's a facet joint on the right, and there's one on the left. And there's one actually at each level. The disc is simply a shock absorber between the different building blocks. And they're numbered according to where they're sandwiched in between. The lowest one is called the L5S1. And ligaments, well, they're basically the duct tape that goes between each of the bones and provides critical stability. Muscles, you know, I don't have any, but the muscles are what power the stability of the back and allow you to run when that dinosaurs are about ready to eat you. And then the tendons are how muscles attach to bone. So those are all the different structures. But most importantly, you're suffering, you're struggling. You see all these ads. We don't want you to be taken by someone that's telling you about birth tissue. So how do you, as a patient, get the very best results from treatment? Number one, experience speaks volumes. Here at the Centennial Schultz Clinic, we're coming on to our 16th year. That's right, 16 years of dedicated work in terms of regenerative therapies in the low back. That's a lot. We're all double boarded. I mean, myself and Dr. Centennial are double boarded. We're fellowship trained, and all the physicians are board certified and fellowship trained. These are not mid-levels. These are not nurse practitioners that do some Botox on Monday and Wednesday and happen to do something on your back on Thursday. That's not acceptable. So again, for you to get the very best clinical results, experience. Number two, accuracy is everything. If we think that your pain is coming from the facet joint, we have to put a needle into that joint under x-ray. So taking your glasses off and pretending this is pin and tail on a donkey doesn't work, but that often is the case in some clinics. So is it a blind injection or is it guided? And then number three, all these parts that I've talked about, the facet, the disc, the ligament, the muscles and tendons, work together. They don't work in isolation. So we look at the spine as a functional unit. And in doing so, it gets the very best clinical outcome. If you do it piecewise, if you're like, well, let's see if the facet's the problem, and you come in and you do the injection, come back, and you do the disc the next week and do that, it's piecemeal. It'd be like taking in your car and them saying, well, it might be the carburetor, let's do this and then take out the car and we'll see you in another week. We want you to get the very best results. So again, the truth about stem cells and low back pain, it's a complex issue. There are many different types of stem cells, bone marrow, fat-derived, and these things called birth tissue, which in fact have no living tissue, or stem cells. There are many structures in the low back that can cause your pain. The facet, the disc, the ligament, the muscles, the tendons and ligaments. How you, as a patient, can get the very best results? Look for experience. Look for physicians that have board certification and fellowship training. Make sure that all the injections are done by a physician under guidance. And then make sure that they're looking comprehensively at all the different tissues and all the different structures and how they work together. And in doing so, you can be assured of the very best clinical outcome. I hope this was helpful. This is Dr. Schultz at the Centennial Schultz Clinic in Broomfield, Colorado. We've been working hard for the last 16 years, and we look forward to speaking with you next week on the same topic, but a little different direction. We're going to be talking about low back pain all this week. If this was helpful, please share it. Till next time, be safe. Thank you.